Are I connected?
So, hello everyone, good evening, and welcome to Anatomy, the high yielding MCQ discussions. So, dear students, as anatomy is a vast subject, and there is gross anatomy, embryology, histology, osteology, and then your neuroanatomy. So, there are five aspects or five sections in anatomy what you need to learn about. So, please understand that majority of questions come from gross anatomy and then embryology. Osteology and histology is okay. The past year questions, PYQs only will help you to master your osteology and your histology. So invest your time more into gross anatomy and your embryology. Even neuroanatomy, so much of questions are not there. So what you can do is, you're reading a lot of MCQ books, I know that. So please read Dental Pulse, Gauri Shankar, and for the neuroanatomy part, you can refer to Mudit Khanna and Ashish Gupta also. These are the medical MCQ books. MBBS people who go for NEET exam, they refer those books. So the standard will be little high. So that will really help you out in your preparation. Okay. So coming directly to the point, high yielding discussions on two topics is there today: salivary gland and thyroid gland. So before I start the questions and go into MCQs, I want to discuss a little bit, maybe in 10 minutes, the anatomy of the salivary glands. And then it's not a theory class, but I just want to brush up the knowledge what you people have. And then we will go into MCQs. And you will see that the way we study and the way the question is asked is entirely different. Same thing, how it is turned and kept into a different question. And what is there in the book and what is there as an MCQ is no connection. So all those things I want you to experience. So that is why I will go first with your normal anatomy. So let me start with that. Okay. So I'm going to start with 5 to 7 minutes for your salivary glands. So dear students, we have got three major pairs of salivary glands. You know that, right? So the three pairs of salivary glands are parotid, submandibular, sublingual. So you should study more about parotid and submandibular, and sublingual is a very small gland, and there are some accessory glands also. So the major function of these glands is saliva making, oral cavity they keep moist, chewing, and swallowing. So just 5 to 7 minutes, I'm going to discuss, revise your whole anatomy with you, and then we'll go into MCQs. So parotid is the largest salivary gland. Please understand that it's an MCQ. So many glands are there, minor salivary glands and major. So this is the largest size wise. It is the largest. It weighs about 15 grams. Now, this is a question which people can go wrong. In old Chaurasia book, BD Chaurasia, it's 15 grams, and in the new book, it is around 25 grams. Right. So I go with 15 grams, but no problem. You current book is the most important ones. You can go with 25 grams. Okay. So then you should know about little bit about the boundaries where this parotid gland is overlapped. Now you see this diagram. This is the one what I am talking about. This orange color one. So anteriorly, the gland extends over the masseter muscle. When you clench your teeth, you get a muscle over here. So anteriorly, you get your masseter muscle. And posteriorly, you have one more muscle here that is called as sternocleidomastoid muscle. And the apex of the parotid gland is below the angle of the mandible. And then this is your superior surface. So the first thing is you should know the weight of the gland, and second thing is the extensions of the gland. And then there are some accessory glands. That is all okay. Next is Now this parotid gland is here, just like a phone which is here. It is covered with some skin or tissue. So that is from the investing layer of deep cervical fascia. Now in our neck, cervical means neck. So in our neck, there are 6 fascias. First one is investing, pretracheal, prevertebral, carotid, pharyngobasilar, and buccopharyngeal fascia. 6 fascias are there. So this is one MCQ. The investing layer of deep cervical fascia forms the capsule for the gland. And this fascia will split between the angle of the mandible and the mastoid process to enclose the gland. That is also an MCQ. So multiple MCQs I am discussing here. So you should open your mind how questions will be turned around. Now I told you the investing layer will split and enclose the gland. The investing layer, that is the upper part, superficial lamina or superficial fascia, what we call it, it will go and attach to the zygomatic arch. So for example, this is your parotid gland. Superficial lamina will attach to the zygomatic arch, and the deep lamina will attach to your here. That is your mastoid, styloid process or mastoid process or tympanic plate, you can call it. This is also an MCQ. Superficial lamina attached to the zygomatic arch, and the deep lamina is attached to the tympanic plate. Then the deep lamina, which is on the back surface of the parotid gland, it splits to, generally it is very weak, very thin, loosely attached. But the central part of it will be strengthened or thickened to form stylomandibular ligament, which separates the parotid gland from the submandibular gland. So this is also very important MCQ, what you should learn. Then coming to the surface marking, that's all not required for you. So then you should know the structure passing through the gland. So you've got 4 surface: superior, superficial, anterior medial, posterior medial. And then you've got 3 borders, that is anterior, posterior, and medial. For whatever it is, this is the diagram what you should know. So your anterior surface, this all structures passes. From superior surface, all this structure. Posterior medial surface, all this structures. From the apex, all these structures. So I'm not going into details of this. I just told you which all areas you should concentrate. Then relations and all, it's okay. And the borders also, anterior, posterior, and medial border. You should know how to, what all structure passing through. That's all, nothing more than that. So the arterial supply of the parotid gland is basically the external carotid artery, which enters, you can see here, from the apex. It is basically from the posterior medial surface. This is posterior medial surface. In the diagram, it is shown at 6 o'clock position, but it should be at 5 o'clock position. Posterior medial surface, and once it goes inside, it gives rise to branches. That is the maxillary artery. You can see here, superficial temporal artery which goes straight, and transverse facial artery here. So these are the arterial supply of the parotid gland. So all these things you should learn. Then the venous drainage or the veins of the parotid gland is the same thing what you read generally in the scalp chapter also. The superficial temporal vein and the maxillary vein, they meet at the right angle. You can see in the diagram. The superficial temporal vein, maxillary vein, both will unite and form the retromandibular vein. So that is an MCQ. The formation of retromandibular vein is by superficial temporal vein and the maxillary vein. Then it comes straight and then it divides into 2: anterior division, posterior division. Anterior division coming towards the nose, front part. So this is anterior division, and backward is the posterior division of the retromandibular vein. So this is the venous drainage of the parotid gland. Then your nerve supply is nothing but the 5 branches of facial nerve. The 5 branches on the face is the mnemonic: 2 zebras bought my car. 5 branches. Okay, so this is what you should know this. The parotid duct generally pierces the buccinator muscle. That is what they ask. and this is extremely important. You should know this. So never miss this part. That is the nerve supply. So parasympathetic and the sympathetic nerve supply. Parasympathetic is basically deals with your secretions. So parotid gland, saliva making. Right. So we have got basic function is secretomotor. So it's motor. So there is something called as sensory and something called as motor. Sensory means information going towards my brain. Motor means information from the brain towards the organ. So I hope you know that. So it's secretomotor. So for example, I see a cake. I love that cake, or I see an ice cream. The sensory nerve impulses will go towards my brain and process. Oh, this is ice cream, your favorite. And then the motor impulses will come to the parotid gland, and then salivary secretion starts. So there is one ganglion. So before the ganglion is called preganglionic, and after the ganglion is called postganglionic fibers. So the preganglionic fibers, from the brain it starts, right? So it is inferior salivatory nucleus. But this you can remember like a mnemonic, right? Inferior salivatory nucleus it starts, it goes to glossopharyngeal nerve, tympanic branch, tympanic plexus, lesser petrosal nerve, and otic ganglion. So up to the otic ganglion, this is your what you say preganglionic fibers. Then after the otic ganglion, it becomes the postganglionic fibers, which comes as auriculotemporal nerve, and through the auriculotemporal nerve, it reaches the gland. So otic ganglion is the ganglion in between. Preganglionic is before, postganglionic, and through auriculotemporal nerve, it enters the gland. So that is also a question what they ask you. Right. So that is all what you should know. So now let's go into the part of our what to say the MCQs. Okay. So I took around 10 minutes. Okay, that's fine. Then the clinical anatomy you should know. Similarly, you should study about submandibular gland, sublingual gland nothing much, and thyroid gland also. Right. So I'll just go for the thyroid gland. So let me discuss that, and then we will come back to everything. Let me go to thyroid gland. Where is thyroid gland? Yes. So thyroid gland is basically again, it is your midline structure. It's your midline structure. So it is basically an endocrine gland. The thyroid gland, it's a midline structure. It's an endocrine gland situated in the lower part of the neck. So basically, thyroid gland is a multi-purpose gland. It is the most versatile and the most important gland. It controls the basic or basal metabolic rate. That is all your biochemistry cycles, right? All your cycles, metabolism, anabolism, catabolism, anabolism, everything controlled by thyroid gland. It simulates your somatic and psychic growth, your intelligence level, everything, and plays a very important role in calcium metabolism. So that is the physiology part. T3, T4, calcitonin, three types of hormones are there, and then you know how it goes on. So basically, thyroid gland have two lobes, left lobe, right lobe, and it's connected with a midline structure called as isthmus. So this is what you should be knowing this. So now just a basic introduction. So this surface marking and not required. Yes, so this is what you are seeing here. The orange color is your thyroid gland. Okay, so above you have got thyroid cartilage. So please understand that this blue color is thyroid cartilage. So the thyroid gland upper lobe, upper part C5 to T1. From C5 to T1. So that is the extension what you should be knowing. So then the situation and the extent of the thyroid gland is basically like this, from C5, C6, C7 and T1. So this is very important MCQ, you should learn this. And the isthmus lies between second to fourth tracheal vein. So this isthmus what you are seeing, second to fourth tracheal vein. Then the dimensions, it is 25 grams. The weight is 25 grams and dimensions are 5 centimeter into 2.5, 2.5. Okay, so that's absolutely okay. Then basically thyroid gland, what you should know is the blood supply, where people ask a lot of questions. Lot of questions come from the blood supply. Before blood supply, this is the cross section of the neck. So this is your thyroid gland, what you are seeing here. This is also very important. Diagram based questions when they ask, this is the question which comes. This is your thyroid gland. So this is the apex. So here next to that you've got sternothyroid muscle, sternohyoid muscle. More laterally you've got omohyoid muscle and your sternocleidomastoid muscle is there. So these four muscles, please understand. This is what you should remember. And then behind that you have got trachea and your esophagus. Then here backside you have got your carotid sheath, the carotid triangle in your triangles of the neck. So this is your carotid sheath, and inside carotid sheath, these three structures what you should know. Okay. So these are basic things, the relations you should know. Arterial supply. I'll just show you diagram and then I'll start. Yes. So this is your thyroid gland. Very important. A lot of MCQs are based on this. So please understand, you have got common carotid artery, and common carotid artery divides into external and internal carotid artery. So this common carotid artery divides into external and internal carotid artery. External carotid artery has got 8 branches. Superior thyroid is the first anterior branch. So the first branch, you see that from the external carotid artery which comes down, 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 and see it's entering the gland. And this is called superior thyroid artery. So it enters the gland, it goes down and it divides into multiple sub branches. So the upper lobe of the thyroid gland is supplied by superior thyroid artery. And the lower lobe of the thyroid gland, you see the down part, it is supplied by something else. So you see this is arch of aorta, your heart, arch of aorta. So from there, you have got your brachiocephalic trunk. So from the brachiocephalic trunk, you get, this is the brachiocephalic trunk, and this is your subclavian artery. So from the subclavian artery, a branch comes here, inferior thyroid artery. So both are separate. What I'm trying to convey to you is, superior thyroid artery is a branch of external carotid artery, which is a branch of common carotid artery. That is a separate thing. Inferior thyroid artery is a branch of subclavian artery and coming, which is a direct branch of arch of aorta. So both are separate things. Okay, don't get confused. So the inferior thyroid artery ascends up, 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 and then it enters the lower pole of the gland. So upper 2/3 of the gland, upper pole is supplied by superior thyroid artery, and the lower lobe of the gland is supplied by inferior thyroid artery. So that is what you should be studying. Then other things are all okay. So now let us go for our MCQ discussions. Okay, so now I'll be putting questions one by one, and then you can answer it. If you have any queries, you can ask me, and then we'll go one by one. So while solving MCQs, there are some questions which you may not be aware of. Okay, first time you will be hearing these questions. So don't worry, it all happens in the beginning, no one knows. It's not important how much you know in the beginning. How much you know in the end, that matters. So that is why don't lose hope if you are not able to answer fast. Take your time. But this is whatever I have explained you in the last 15 minutes. 10 minutes I have done parotid gland and 10 minutes thyroid gland. So this is what you have studied at an undergraduate level. Now see MCQs how it's turned up. So even if some question comes, read around that. That's it, and make your knowledge to next level. Let's start. Salivary gland and thyroid gland is today's portion. Okay. Submandibular gland, I didn't teach you. I told you to study. So please study back. And this class is there in YouTube. You can always come back and refer to these questions. Submandibular gland is situated in which of these four triangles? Digastric triangle, carotid triangle, muscular triangle, or deep to hyoglossus? Just answer. Don't get scared. A, B, C. Chat box is active. Please answer. Participate. If you're wrong, no problem. But you should always answer. Okay, so I expect all of you people who are attending now, please answer something. It's okay to be wrong, okay? Please understand that. But if you're not answering, not making an attempt, then no use actually. Yes, so answers are coming. Very good. I will not tell your names, so don't worry. Please answer. Okay, very good. What about others? If I'm very clear, if you're not serious about this, then there's no point attending the class also. You have to participate. So I request all of you to answer. Yes. So answer is correct. Submandibular salivary gland is situated in which of the triangles? So here in the neck, you have got submental triangle, digastric triangle, carotid triangle, and muscular triangle. Four triangles are there. So your submandibular gland is here, submental and digastric, and this whole region is called submandibular region. So it is situated in your digastric triangle. So this is what a direct question which you answered. So you thought this much if you read is enough. No, you have to read more than this. You should know everything now. So they asked you about submandibular gland, right? So you should know about parotid and sublingual also. That is how you have to study anatomy or any subjects. Now you should know the situation, the duct opening, parotid glands, the duct is called Stenson's duct, and where it opens. See, these are the past year questions. 3 questions have come from Stenson's duct. What are the secretions? Sericin secretion. So the orifice of the parotid duct is located between buccal mucosa near the maxillary second molar. And in your DADH, dental anatomy and oral histology, they say first molar. So between first and second molar, you can put it. Then duct of the parotid gland crosses over which muscle? Well, I was teaching you the theory part. I told you that it over the masseter muscle. And the secretive motor supply of the parotid gland is through which ganglion? I told one ganglion was there. Preganglionic, postganglionic, otic ganglion. So 3 MCQs have come from the basic part of your parotid gland. So you should know the situation, duct opening, secretions also. So similarly, you have to do for other things also. So submandibular gland, the duct is called as Watson's duct. And the secretion is mixed secretion. And other questions associated with, so many are there. These are some of the top questions. Which of the following muscle divides the submandibular gland into superficial and deep? Very common. If you see the diagram of submandibular gland, one muscle will be coming like this, and that muscle is called mylohyoid muscle. And sublingual gland is the smallest, and the duct of the sublingual gland is called Bartholin's duct. And it is basically again a mixed in secretions. And then 80 to 20 excretory ducts are called the duct of Rivinus. It's an extra information. The largest duct of this is called Bartholin's duct. Please learn this, okay? Coming to sublingual gland, these are the past year question. Sublingual salivary gland lies superior to mylohyoid, and which is that the duct is associated is duct of Rivinus. So these are the basic MCQs which has been asked. We are reading actually what question? We are reading submandibular salivary gland is situated in where? So we should know situation of every other gland also. What is the duct? What is the secretion? And other questions. This is how you have to study. And then this nerve supply, that is your secret, it's very important. That's what you say that parasympathetic and sympathetic right? Very important. So it starts with inferior salivary nucleus in the pons. Then preganglionic fibers goes to the glossopharyngeal, tympanic branch, tympanic plexus, lesser petrosal nerve when it goes to OT ganglion, and after OT ganglion to the auriculotemporal nerve, which is the gland. So they can ask you through which ganglion? That is your otic ganglion. Okay. So this is your ganglion in the diagram. So they can even mark some of the landmarks, some of the labeling, they can block it and they will tell you what is it. So this is from the inferior salivary nucleus. It starts tympanic branch, lesser petrosal nerve. It enters the otic ganglion, and from there it is called as postganglionic fibers, and through auriculotemporal nerve it reaches the parotid gland. So please learn this, okay? This is extremely important. Next question. The tendon of sartorius, gracilis, and semitendinous muscle forms a pes anserinus at the neck of tibia. Similar kind of structure is also seen in. Now this is a question which is really tricky. What is this called? Pes anserinus. So it's just like you have seen duck feet. The duck feet is web shape. So that is the similarity of pes anserinus. So here the answer is your parotid gland. Okay. The tendon of sartorius, gracilis, and semitendinous muscles forms a pes anserinus, that is web shape. I'll show you a diagram. Similar kind of structure is also seen in parotid gland. Parotid gland, your facial nerve enters and then it divides into 5 branches. So that is what they are talking about. See this feet. This is called as pes anserinus, the duck feet. So this is the same in our muscle also. Sartorius muscle, gracilis tendon. Just now the question was framed, right? It comes down and all these 3 muscles forms like a duck shape feet. You see here the web shape. It looks the same. Same thing is seen here also. Like this. So that is your pes anserinus or parotid plexus. It is a point from where the dividing of the 5 branches take place. You can remember like the mnemonic: 2 zebras bought my car. 2 temporal, zebras zygomatic, bought buccal, my marginal mandibular, car cervical. So I hope you got the concept what I am trying to tell you. Next question. The structure that does not transverse parotid gland. So you should know the structures passing through parotid gland now. The blood supply of everything, I showed you the diagram also. So in that, which of them is not passing? So this is what is extremely important. So we have seen that there is external carotid artery, superficial temporal artery. So answer is internal carotid artery. Internal carotid artery never enters the parotid gland. You see this is your parotid gland. This red color is your external carotid artery. So the structure which enters the parotid gland. The question is the structure which enters the parotid gland. This is the mnemonic. PRF MES. PRF. So parotid lymph nodes, retromandibular vein, F facial nerve, and then MES, maxillary artery, external carotid artery, and superficial temporal artery. In the external carotid artery, we have got 8 branches. Out of 8 branches, 5 branches are there in the parotid gland. So that is an MCQ. Out of 8 branches of external carotid artery, 5 branches are there inside your parotid gland, which comes out. And the 5 branches mnemonic, which I am going to tell you, please write it down. SALFO, SALFO. S, superior thyroid artery. A, ascending pharyngeal artery. L, lingual, facial, occipital. These are your 5 branches of external carotid artery, which is there. And inside the parotid gland, PRF mesh. So from inside the parotid gland, you've got external carotid artery and external jugular vein. So internal carotid artery is not there. From the inside the submandibular gland, you've got facial artery and veins draining into common facial vein or lingual vein. And in sublingual gland, you've got sublingual and submental arteries. So you should know the diagram of the gland and what are the structure passing through that. Next part. Deep part of submandibular salivary gland is related to. Now, submandibular salivary gland is actually like this. If you see, it's like this. Superficial part, deep part. Okay, so this is the deep part. My thumb is the deep part. So deep part of submandibular salivary gland, which is here, what all structure is related to? So it's basically on the relation part. So facial nerve, lingual nerve, accessory nerve, mandibular nerve. Please try to answer. Yes, please answer. It's okay to go wrong. There's nothing wrong in going wrong, but absolutely wrong in not trying. If you're not trying means you'll just come here for time pass. And let me tell you, the time will pass. Please participate. Let it go wrong. Again and again, I'm telling you. Because in that way, at least it shows that you're serious and you're making an attempt. Otherwise, it is just like one TV serial. You see it, it goes out. It's okay. Yes, so good. If you're answering. So the answer is the deep part of submandibular salivary gland is in relation to lingual nerve. Deep part of submandibular gland, lingual nerve. So for this, you see this. So submandibular salivary gland, which you are seeing here, is small in size. It lies deep to mylohyoid muscle. One MCQ was there, and it is superficial to hyoglossus and styloglossus muscle. So that is the relationship what you should know. Then it is lateral to mylohyoid, medial to hyoglossus, above lingual nerve, and below hypoglossal nerve. So it is the submandibular gland is above lingual nerve. So suppose this is lingual nerve, so it is above lingual nerve. The deep part of the submandibular salivary gland is related to lingual nerve. So that is what the question was. So please learn the diagram. It's okay to go wrong. It's very okay to go wrong. You're in the initial stages. But please make sure you learn it. Takeaway messages should be there. Okay, this question was asked like this. So I should go back and read all the three salivary glands in the same method. Next question. Which of the following is not present on the medial surface of the submandibular gland? So now they're asking the relations also. Medial surface, lateral surface, superior, inferior. The same thing you should learn for parotid gland also. Yes, please try to answer. Which of the following is not present on the medial surface of the submandibular gland? Answer is facial vein. See this. So in the inferior surface, you have got skin, platysma muscle, cervical branch of facial nerve, and all these structures. Lateral surface, this thing, and medial surface are this things. So your facial nerve is not there. Facial nerve is cervical branch of facial nerve, the last part, which is here on the inferior surface, not on the medial surface. A little tough diagram, a tough question I can call it, but you have to learn this. These are the areas where people go wrong. These are the questions which repeatedly come also. So every chapter has some areas. If such areas you catch it up, it's very easy there. Parasympathetic nerve supply to salivary gland is by. Just now we did this. Seventh nerve and ninth nerve, ninth and tenth nerve, fifth and tenth nerve, seventh and ninth nerve. Yes, please answer. Yes. So it is facial nerve and glossopharyngeal nerve. You see this. This is your otic ganglion, right? And then this is for your parotid gland. And this is for your submandibular gland. The pathways. So from inferior salivary nucleus, it comes to the glossopharyngeal nerve. From the glossopharyngeal nerve, tympanic branch, tympanic plexus, it goes like this. So for the parotid gland, it is glossopharyngeal. And for submandibular gland, the facial nerve, seventh facial nerve. So 7 and the ninth nerve, that is glossopharyngeal, is the correct answer. You should learn this pathway also. Now coming to thyroid gland. Inferior thyroid artery arises from first part of subclavian artery, thyrocervical. This is a direct question. Just now I told you also. Thyrocervical trunk of first part of subclavian artery, third part of subclavian artery, or it is a branch of internal carotid artery. So that is subclavian artery, but it is the thyrocervical trunk of the first part of subclavian artery. Correct answer. So the thyroid gland will be there from the down, from the arch of aorta, it ascends up. So that is from the thyrocervical trunk of first part of subclavian artery. So this much detailed anatomy is not studied in gross anatomy first year BDS. That is why even if you read the gross anatomy, the BD Jorasia book, this information, that much detail is not given. That is why you should do as many MCQs as possible after reading BD Jorasia and then come to it. Please understand, anatomy is a subject which you require textbook reading. First, you should go through your basics, because most of you would have studied anatomy first BDS, and all of us studied first BDS. So it's almost 5.5 years. So you need to again revise it through the textbook with the diagram base. That is the only way where you can master anatomy. Otherwise, just reading MCQ books will not help you in understanding anatomy. So this is the same explanation. I will not repeat, which I have already told, right? The blood supply from the external carotid artery, you get superior thyroid artery, which enters into the upper lobe. Upper 2/3 it supplies, and the lower 1/3 is supplied by the inferior thyroid artery. So this all information is there. You can read this. The question again, relevant questions. On the right hand side of the screen, you can see the level of branching of common carotid artery. So common carotid artery, at what level it branches? At the upper border of thyroid cartilage. So that is the answer. Then external carotid artery is one of the two terminal branches of common carotid artery. The other one is internal carotid artery. That is very simple. So please read this. I have already explained this right now. Then in the veins of the thyroid gland, you've got superior, middle, and inferior thyroid veins. So please understand, the superior and middle thyroid veins, they club together and they drain into internal jugular vein. The inferior thyroid vein drains into left subclavian vein. And there is again a fourth vein which is called as Kocher. The fourth thyroid vein called Kocher vein, which drains into internal jugular vein. This is extremely important. This is there in your MCQ books also. Learn this question perfectly. So the answer came before. Ansa cervicalis injury leads to which muscle? So first and foremost, where is ansa cervicalis? It is in your carotid triangle first. You have got a carotid triangle, carotid sheath you have got. So your ansa cervicalis is like one chain-like muscle. Chain-like strip it goes. Right. So from the hypoglossal nerve, it descends down, forms a loop and goes up. So that's got two heads, upper head and the lower head, or whatever you call it. So ansa cervicalis injury leads to which muscle? Sternothyroid muscle. This is what I was talking about. So from the hypoglossal nerve, it comes down, it descends down and takes a turn. So this turning point, hairpin bend, is ansa cervicalis. So here Three branches it has got. Superior belly of omohyoid, stenohyoid, stenothyroid. This is what you should know. Okay, so this is what you should know. So in anatomy, diagram based. Again and again, I am telling you it's diagram based. So this is question picked up from your embryology. Superior parathyroid glands are derived from first brachial pouch, second brachial pouch, third brachial pouch, fourth brachial pouch. So in embryology, it's a limited things what you have to study. This chart is there. If you are studying dental pulse book, you know that there is a chart and there is this question, whole dedicated chapter in your Inderbeat Singh book. Answer is fourth brachial pouch. This is the chart I was talking about. So from the first pouch, you get three structures: pharyngotympanic tube, middle ear cavity, tympanic antrum. From the second pouch, tonsil, pubotympanic recess. Third pouch, inferior parathyroid gland and thymus. Fourth pouch, which was our question, superior parathyroid gland. And fifth pouch, parafollicular cells of thyroid. So please learn this. This is extremely important. One or two questions. Generally, one question comes from embryology, and this area is hot favorite for that. So, dear students, I just gave you sample of questions. I know that every question is not discussed, but I gave you an idea, the in-depth knowledge how you have to study, and have shown you the spectrum of the questions what comes in the exams. So initially I started with the basic anatomy chapter, what you study in gross anatomy. I just revised it and then went on to questions. So during the questions, some were direct and some were completely out of the box. That is why you should do as many MCQs as possible, as many different books you should do, so that you will get a perfect knowledge. But in anatomy, I recommend first go through your textbook, whichever textbook you have studied. I assume that you have studied BD Chaurasia. So first go with that. And once you are done with that, go with your dental pulse book. Synopsis you can read and then go to the MCQs. And once you are done with dental pulse book, then you can take Gauri Shankar book, Bhatia book, MCQ books I am talking about. So that is all your standard is going high. And then there are a lot of small MCQ books in the market subject wise. That also you can pick. Don't blindly mug up the answers. Answers can be printed wrong in the text, in the books, MCQ books. You need to verify those answers. So once you read the textbook, you will have an understanding, okay, this answer is sounding wrong. Then you can verify that answers. So always practice a little bit diagram also, because diagram based questions are also there. Relations are also asked. So basically, that is how you have to read anatomy a little different way. So three subjects I recommend all of you to read textbooks before going into MCQ. One is anatomy, second one is pharmacology, third one is oral pathology, and fourth one you can call it dental materials also. Just four books, read the textbooks and then go into MCQs. Otherwise, it will be very difficult. Okay, so that's all for today. A small topic it was. So tomorrow, next class, we will come with a detailed topic, mouth and pharynx. So please read the chapter before and then we will solve the MCQs. Okay then, thank you so much.